Hi, I'm going to give a report on a 17-year-old man. His name was Jose Ochoa. And I did an assessment on him of his head, eyes, nose, ears, and mouth, neck, and throat. I checked his head. He had no tenderness when I palpated, no lumps, bumps, or bruises. I checked his scalp, and for any irritation or redness, he had no dandruff or anything. I checked his hair. His hair color was dark brown, clean and clear. And I moved down to his face to see his symmetrical with his eyes, eyebrows, nose, ears, and mouth. Everything was symmetrical. And then I palpated his temporal arteries, and they were palpable. And then I checked for his frontal and maxillary sinus. And then I checked for cranial nerve number 5 and 7. It was intact. And then I went down. I did his eyes, his external structures, no drainage or irritation. Then I checked his conjunctiva. It was nice and pink. And then his sclera was nice and white. His iris was brown, and his cornea was nice and round. Then I checked cranial nerve number 2, 4, 3, and 6. They were intact and equal and reacted to light. Then I moved to his nose. I checked his symmetrical, and I checked if they have no drainage or irritation. I checked his septum. It was midline. His buccal mucosa in the nose, it was clear and moist and pink. And then his patency was clear. And then I checked for cranial nerve number 1, which was intact. And then I moved to his ears, no drainage and a nice tenderness when palpating. And then I checked cranial nerve number 8, which was intact. Then I moved down to his mouth. His lip was nice and moist. I checked his mucosa, his teeth, his gums, his tongue, his tonsils, and his soft and hard palate. And then there was nice and moist and without irritation. And then I went to his cranial nerve 9, 10, and 12, and it was intact. Then I moved down to his neck. It was symmetrical. His trachea was midline. And then all his nodes were intact and were palpable. I did the thyroid exam. It was palpable and without enlargement or tenderness when touched.